Assalamualaikum and hi. My name is Nurmahirah Binti Jiman and my metric number is BM23110036. In this video, I'm gonna talk about female reproductive organ. This is the content of this video. Firstly, anatomy of female reproductive organ. Next, I'm gonna talk about the disease related to female reproductive health and its treatment. Lastly is a well-known gynecologist. Now, let's take a look at the anatomy of female reproductive organ. Firstly, I'm going to explain about the ovary. Ovary is a small and oval-shaped gland that is located on the side of the uterus. The function of ovary is to produce eggs and also hormones such as progesterone and estrogen. The second one is fallopian tube, or also known as uterine tube. It is a tube between the ovary and the uterus. The function of fallopian tube is to transport fertilized egg to uterus for implantation. Lastly, I'm gonna talk about the cervix. Cervix is a muscular and tunnel-like part of the female reproductive organ. The function of cervix is to allow fluid pass between the uterus and vagina. Next, I'm gonna present about diseases and its treatments.
The first one is cervical cancer. Cervical cancer is a type of cancer that develops from cells in the cervix. Some of the signs and symptoms include unusual vaginal bleeding, pelvic pain, pain during intercourse, and also abnormal period, where the bleedings are heavier and lasts longer than usual. There are two main types of cervical cancer, where the first one is squamous cell carcinoma. It is a cervical cancer that develops from cell in ectocervix, which is portion of the cervix that projects into the vagina. The second one is adenocarcinoma. It develops in glandular cells of endocervix, which is the inner part of cervix. Here are some of the treatment by stages for cervical cancer. For stages 1 and 1 is called nerve conization and total hysterectomy, which is the surgical removal of the uterus and cervix. For stage 1 and 2 is modified radical hysterectomy and removal of lymph node. For stage 1B and 2A, chemotherapy, radical hysterectomy, and also radiation therapy. For stages 2B, 3 and 4A is radiation therapy and chemotherapy, pelvic lymph nodes removal. And for stage 4B is radiation therapy and chemotherapy. The second one that I'm going to share is endometriosis. Endometriosis is a condition where the tissue that is similar to the inner lining of the uterus grows outside of the uterus. The signs and symptoms include very painful menstrual cramps, heavy bleeding during periods or spotting between periods, infertility, and also abdominal pain or back pain. Endometriosis can develop in several places, including fallopian tubes, ovaries, vagina, and also outside and back of the uterus. The treatments for endometriosis includes birth control, gonadotropin-releasing hormone, medications, and also surgery. The last one is uterine fibroids. So what is uterine fibroids? It is an abnormal growth that develops in or on the uterus. The signs and symptoms include menstrual clots, pelvic pain, heavy periods, and swelling or enlargement of abdomen. Uterine fibroids is diagnosed via abdominal ultrasound, transvaginal ultrasound, pelvic MRI, and also hysteroscopy. There are three major types of uterine fibroids, where the first one is intramural fibroids. Intramural fibroids grow within the muscular uterine wall. The second one is submucosal fibroids, which bulge into the uterine cavity. And the third one is subserous fibroids, which project to the outside of the uterus. There are a few treatments for uterine fibroids, which includes myomectomy, which is the removal of fibroids but the uterus are still intact, hysterectomy, birth control, oral therapies, and also gonadotropin-releasing hormone agonists. Gonadotropin-releasing hormone agonists acts by blocking the body from making estrogen and progesterone, which will put patient into a temporary menopause-like state. This causes menstrual periods to stop and causes fibroids to shrink. Now, let's take a look at a well-known gynecologist. A gynecologist is a doctor who diagnoses and treats issues with female reproductive organ. Meet Dr. Anjali Kumar, a gynecological endoscopic surgeon from India with more than 30 years of experience. She is known for her successful treatments of patients both in the country as well as abroad. She has introduced reverse uterine closure technique for suturing very thin lower uterine segment, which has been accepted at Apex National Conference as Kumar's technique. Dr. Anjali Kumar has been awarded as Inspiring Gynaecologist of North India in 2019 by the Economic Times. She is seen on various television talk shows. She also features a lot on gynecology-related issues in newspapers, magazines, and also web portals. Some of Dr. Anjali Kumar's areas of interest include laparoscopic hysterectomy, laparoscopic myomectomy, laparoscopic endometriosis surgery, and also vaginal and abdominal surgeries. Some of the conditions that has been treated by Dr. Anjali Kumar includes PCOD, endometriosis, menstrual disorders, ovarian cysts, pelvic floor disorders, and also uterine fibroids.
That's all from me. Thanks for watching.